I'm Dr. Rick Mitchell of Fairfield Equine Associates, that's based in Newtown, Connecticut, Wellington, Florida, and we also have a satellite practice in the western North Carolina area near Tryon. I have been the team veterinarian for the U.S. equestrian jumping team at 3 Olympic Games, and also was team veterinarian for the U.S. dressage team at 3 other Olympic Games. I've spent the last probably 40 years almost working with FEI level show jumpers and dressage horses, as well as USEF show horses of various disciplines. And so the incidence of soft tissue injuries and so forth in my practice are pretty significant and something we deal with on a very regular basis. I was first introduced about 2.5 years ago, and really honestly only started using the product in 2021, 22, but I have since been so impressed with specifically the Regeniflex product and the results that we've been getting that it has become a real go-to for me with regard to tendon and ligament injuries. I can go way back in history, so to speak, about 20 years. The first extracellular matrix product that I was exposed to was a product called A-Cell, which was porcine urinary bladder matrix. It was loaded with collagen and a variety of growth factors, and it had a phenomenal stimulatory effect on tissue to get it to heal. However, it also had a rather inflammatory effect in many cases, and unfortunately had some untoward reactions that veterinarians worried about. But we learned to use that product quite successfully and found that it really did help to guide healing of injured tendons and ligaments, as well as cutaneous structures, and within the eye as well. So that was my first exposure to an ECM type product. Later on, I dealt with a few amnion-based products that were of equine amnion, and we found that they were somewhat less reactive. However, I was a little disappointed with a few of them that didn't seem to really push the regenerative process quite enough. So we sort of fell back into using stem cells and both bone marrow origin, autologous bone marrow origin, and allogeneic bone marrow origin. And in the last 5 years, I would say that I moved more toward using allogeneic cells because it was a simple process. I identify the injury, make a phone call, have the cells in 1 to 2 days. That's nice, rather than having to wait to expand a bone marrow sample that I had taken from the horse, which is also an invasive procedure. The nice thing now that we have with Regeniflex, in particular for me, is that I've got that ability to have a horse-side product that has much of the same capacity, it would seem to me, that the allogeneic and autologous stem cells had. And we've had significant healing responses in response to the use of the product both intralesionally and perilegionally in tendons and specifically suspensory ligaments and distal sesamoidean ligament injuries, which can sometimes be really difficult to get to heal. And we've had some very encouraging results with minimal reactivity. I think that any of these products have the potential to have a little reactivity, but I have to say that with the Regeniflex products, I have not had anything that was frightening. And they've all been very manageable. And my results with the products have been consistently rewarding. The exosome process and refinement of the content of the Hilltop Bio products has made that a much more comfortable process, because I think we're getting the direction, the instruction to the tissues to recruit the right kind of progenitor cells without recruiting inflammatory cells. And so that has really, I think, been the rewarding part of using these products, and why we're seeing less inflammation and less reactivity, but yet we're still seeing a good healing response. And that's what's unique about the Hilltop Bio products. I can think of one very specifically right away that was a lovely dressage horse that was initially purchased to be a horse for the owner of the farm, for her to lesson on and learn to become a more upper-level dressage rider. And this particular horse sustained an onset of lameness that was ultimately attributed to a rather severe tear in the lateral oblique distal sesamoidean ligament of the right front leg. And he was quite lame, and it was quite a defect. Initially, we tried some PRP in the lesion, and it provided a little bit of improvement. But then subsequently, we tried the Regeniflex product in it, and the healing the healing response in 60 days was remarkable, and within 120 days we had a lesion-free oblique distal sesamoidean ligament. The horse has returned to work and has done very, very well, and is currently, doing his job quite well. But that one was one of the early ones I had done, and that's why it comes to mind, because I thought, I want to give this product a shot here, because it didn't respond as well to more traditional orthobiologic at first, and that's why I went to that product. I would say that there's really no justification for the hesitancy, other than the fact that they haven't used it. I've always been a skeptic about new products. I've always sort of sat back and let someone else try them a little bit, and that's maybe why I didn't jump right on the bandwagon with the Regeniflex product, because I wanted to see and hear what sort of responses other people were having. But I feel it's a safe product if used as it's meant to be used. The Regeniflex is not the Stridex product. The Stridex product is meant to be used intra-articularly. The Regeniflex product is meant to be used in tendons and ligaments and soft tissues of various sorts. And so, used appropriately, I think it's very safe, and I think the response to healing has been very rewarding. I found the company to be very responsive, ready to provide information if I needed it. In a few cases where I have heard of other veterinarians having questions regarding the product's use or whatever, they seem to me to have been very responsive to their needs right away. I really have no negative comments about my interaction with Hilltop. It's been a very rewarding experience.